We are taking your calls and questions for Dr. Zorba Paster.
We have 2 lines open at 608-270-9933. Hi, Zorba, good to see you.
Good to be here.
It's been a couple weeks.
Yeah.
Let's go to the phones. We'll start with Denise from Beloit. Hi, Denise. What's your question?
Denise, are you there?
Yes.
Go ahead.
Oh, I've gotten my first shingle shot. How soon after that do I get my second one?
Okay, she got her first shingles shot. How soon before she gets the second?
Well, she can get the second. Well, first of all, you have to find out what it is. I can't remember the exact amount of days between the first shot and the second shot. But this is a very important point. The point is only about 30% of the country that can get shingle shots are actually getting their shingle shots. And so it's a big issue. If you've had chickenpox, if you've had problems with chickenpox, in the past, and most of us our age had chickenpox, you are at risk for shingles, and it's awful. And getting that shingle shot is really important. And the GSK shingle shot, which is the new one that's there, is 95% effective against getting shingles. So it's important to get that second shot. And now that COVID is loosened up, we've got to go and get our shots. Shingles, we have to look at shingles, we've got to look at pneumonia shots, and we all have to be completely immunized.
So if you had chickenpox as a child, the
virus is in you.
The virus is in you, and the virus can erupt at any moment. It is laying dormant in anyone who has actually had chickenpox. So the answer is get your shot, call up. It's a 2-shot regime. It really works well. It does hurt a little bit. Some people get a little bit of a headache, but the reality is you just work with it.
What if you've had shingles?
You still get the shingle shot because you're still at risk for actually getting shingles again.
Okay.
Even if you have you had shingles?
Yes, I have.
Yeah, that's right. Did you get your shingle shot?
No, I haven't. I will.
Get your shingle shot.
Do you want to get your box turned on here so you can hear the calls?
That's right, so I can actually hear the calls. I got to hear my boxes over here.
Oh, there it is.
Yes, I have to turn it on, then I'll actually
There you go.
There we go.
That's the problem.
Doctors. Let's go to Sally in Sauk City. Hi, Sally.
Yes. Can osteopenia be reversed?
Well,
Good question.
That is an excellent point. The point is, it's not osteopenia, it's osteoporosis that we really worry about. And osteopenia is sort of pre-osteoporosis, so it's sort of like a yellow light, it's a wake-up call. And the answer is yes, exercise, taking alendronate, one of the drugs that we actually use for osteoporosis, can make a difference. Making sure you get enough calcium in your diet, all those things are important. And when we look at osteoporosis and osteopenia, the real risk is you don't want to fall and fracture your hip or your arm. And the answer to that is exercise, which means strengthening exercise, balance exercises, and then aerobic exercise.
Vitamin D supplements?
Vitamin D, 2,000 international units a day. Very good point.
Okay. I don't know if this call is right. Oh, there you go. Let's go to Al in Madison. Hi, Al. What's your question?
Yes, I had a shingle shot September 9th of last year, and then I had severe back issues and totally forgot to get the second shingle shot. And I'm just wondering if I need to start over, or do I just get that shingle shot now?
You just get the second shingle shots. That's all you do. It's a 2-shot regimen. Even there, you'll still get some good results from it. Is it the exact amount of time? No. But will you get a result? The answer is yes.
Did you have a follow-up to that question?
No, that's fine. I'm just wondering how effective it is if I get it,
it will be
11 months later.
Exactly how effective. I don't think we know exactly, but the answer is the second shot will still reduce your risk of getting shingles.
It's good that you remembered.
And that was Nita.
That's right.
Not Al, because we don't have Al. It's a live virus shot, though, right? The single shot?
Right.
So does that preclude some people from getting it?
Right. And so when you call up your healthcare provider, they'll look at your information. They'll see whether or not you can get it. It's also a function of other medications that you're on. So the answer is most people can get the shingle shot, and not everybody.
And is there an age range?
Well, it starts at the age of 50. That's now the recommendation. But if you look at people over 65, it's covered on Medicare Part D. You get it at the pharmacy. And right now, because many pharmacists are no longer giving out COVID shots, it's a good time to get your shingle shot because they're wide open in terms of making an appointment.
And speaking of COVID shots, still get the second booster.
Absolutely get the second booster. And we'll know more about whether or not there's a new regime in the fall. So whether or not we get a third booster or a fourth booster, we're going to live with this just like we live with influenza.
You know, a lot of people, myself included, have 4 shots and still got COVID.
Right.
But didn't end up in the hospital.
Exactly. And that's kind of what, 95% of the people now, according to CDC, in the country have either gotten COVID or they've ended up getting immunized. So they've started to reduce the amount of time that you actually should rest after COVID and, make sure that you're not in contact with other people. But yes, you didn't end up in the hospital. You didn't end up seriously ill. It was like a bad case of the flu.
That's exactly right. Yeah.
All right. Well, thank you all for calling in. We're out of time. Zorba, good to see you. We'll see you next week.
Good to see you guys.
Good to see you, Zorba. We'll see you soon.